Good afternoon. My name is Dion Gaudet, and I'm with the Office of Disease Prevention. And welcome to the applicant webinar for the NIH Funding Opportunity Announcement PA 18932, Increasing Uptake of Evidence-Based Screening in Diverse Adult Populations. We will spend this hour walking you through the purpose for this collaborative initiative, providing you with tips on finding the best NIH review study section for your application, and walking you through the scientific priorities for each participating institute in relation to this announcement. So, a few housekeeping. You can submit questions during the webinar by clicking on the question mark in the WebEx tool. Please direct your questions to all panelists, and we will open the floor to the questions that have been submitted via WebEx at the conclusion of all of the talks today. So we will start reading and responding to questions at the end of the presentation. In addition to the Office of Disease Prevention, there are 7 institutes that are participating in this announcement, and you see them listed here: the National Cancer Institute, the National Institute on Aging, the National Institute on Alcohol Abuse and Alcoholism, National Institute on Drug Abuse, National Institute of Dental and Craniofacial Research, National Institute of Mental Health, and the National Institute on Minority Health and Health Disparities. We also have a scientific review officer with us from the Center for Scientific Review. So with this funding announcement, we are looking to support applications that seek to understand strategies to reduce disparities in the uptake of evidence-based screening. We define screenings as those screenings that are focused on undiagnosed disease in asymptomatic populations. And we consider evidence-based screening to be those that have proven to be effective based on rigorous systematic reviews of evidence by authoritative committees, such as the U.S. Preventive Services Task Force. This announcement is also focused on diverse populations. We are defining diverse populations by race and ethnic groups, and those groups are listed in the link on page 1 of the Associated Frequently Asked Questions document. They're also defined by socioeconomic disadvantage, rural and sexual gender minorities. And later in the presentation, Dr. Rena Das will provide additional detail about how diverse populations need to be defined. Additionally, we do not have a specific list of screenings that are the focus of this announcement. However, it might be helpful for potential applicants to take a look at screening tests that are recommended by authoritative bodies such as the U.S. Preventive Services Task Force or similar entities, and to discuss your interests in a proposed screening test with the scientific or program official from at least one of the participating institutes prior to submitting your application. So for the purpose of this funding opportunity, the screening process, we see it as a continuum that encompasses 5 phases. What you see here is risk assessment, detection, diagnosis, disease or risk factor treatment. The final phase is considered an assessment for the final outcomes of screening and involves longer-term assessment of risk, functional status, clinical status, adverse events, and quality of life or death. For further detail, again, please refer to our frequently asked questions document that's associated with this announcement. And please also speak with your scientific or program officials. So now we will move on to tips for finding the right study section. And Dr. Yvonne Ferguson from the Center for Scientific Review will take the lead.
Good afternoon. So this presentation is tailored to focus on how you would find the right study section to review your application submitted to this funding announcement. So let's get started. So this is where you would start. Visit our website. The address is listed on this slide. You can do a keyword search, or you can use our assisted referral tool, which is explained on the next slide. Here's a screenshot of our assisted referral tool. After you have your abstract and specific aims, you can cut and paste it. After you have your abstract and your specific aims, you can cut and paste that information in this tool, which will result in getting a list of relevant study sections for your proposed research. Alternatively, you can also browse the study sections and visit our website as well. And you would browse these in the clusters of study sections that we call integrated review groups. You can look at the individual study sections in the clusters and get more information about them. There are two specific study sections that are probably most relevant to the applications that will be submitted under this funding announcement. They are both in the Healthcare Delivery and Methodologies Integrated Review Group and are the Dissemination and Implementation Research and Health study section, and also the Health Services Organization and Delivery study section. And I'm going to talk about both of them briefly. Here's a screenshot of the Dissemination and Implementation Research and Health study section. We have recently updated our study section descriptions. So I strongly encourage you to visit our website listed here for more information. Typically, the study section reviews studies that focus on how health information, interventions, and scientifically based clinical practices are adopted in public health and healthcare in a variety of settings. Research approaches may include qualitative methods, quantitative and mixed methods approaches, experimental and quasi-experimental designs. And from our webpage, you can also see a list of our standing study section members and also the roster of previous meetings to get an idea of whether you think the background of these reviewers would be appropriate to evaluate your proposed study. So please visit the webpage listed here to understand what type of applications are typically reviewed here. The study section description for the Health Services Organization and Delivery study section has also recently been updated. Typically, the studies reviewed by this study section focus on the availability, access, and acceptability, quality of care, cost and cost effectiveness, comparative effectiveness, and financing of healthcare services. We also on the website have shared interests and overlaps. Clearly, there's going to be some shared interests with the Health Services Organization and Delivery study section with the Dissemination and Implementation Research and Health study section. Applications that use implementation science principles and focus on the dissemination and implementation of evidence-based practices, guidelines, and interventions into healthcare delivery are assigned to DIRH, the Dissemination and Implementation Research study section. Applications that focus on healthcare organization characteristics, performance of the delivery of services, measures of quality of care, clinician and hospital performance, healthcare provider, and healthcare delivery system characteristics may be assigned to HSOD. Please note that there are many other study sections that may be relevant to the science that you propose, so I strongly encourage you to visit our website for more information about the various study sections. After you know what institutes and what study sections align with your proposal, we strongly encourage you to complete the assignment request form. Here you can make assignment requests, identify potential conflicts of interest, and most importantly, at least to me as a scientific review officer, list your areas of expertise needed to evaluate your application. Please note that you should never suggest specific reviewers. As I've mentioned, we have recently updated our website with more information and videos to help guide applicants through the peer review process. This is a screenshot and link to a very informative video featuring our acting director, Dr. Noni Burns, division directors, and seasoned SROs who help answer the top 10 NIH peer review frequently asked questions. Please check this video out when you get a free moment. And also, if you have questions along the way, we are here to help. Before you submit, talk to your program officer at the institute where your science aligns with their priorities. You can also talk to your scientific review officer. After you submit, you can call your program officer who is listed at the top left-hand corner of your summary statement. You can also email or call us at our grants info team at the email and number listed on this slide.
Thank you, Dr. Ferguson. So now we will move on to the areas of interest for the participating NIH institutes. First, we have the National Cancer Institute. The scientific points of contact are Drs. Erica Breslow and Antoinette Percy-Laurie. Due to scheduling conflicts, they're unable to be with us today, so I will present their priorities. The NCI leads, conducts, and supports cancer research across the nation to advance scientific knowledge and help all people live longer and healthier lives. In this FOA, NCI has 6 areas of interest that includes multi-level interventions. Multi-level interventions address at least 2 levels of the healthcare environment. That may be the individual, the healthcare team, the healthcare system, or the community setting where the healthcare system is located. Promotion of HPV screening and teamwork processes, shared decision-making, and follow-up to abnormal screening tests are of interest. Mechanisms that enhance or inhibit evidence-based screening are also of interest to this institute. Then we have development or testing of multi-level strategies, which includes implementing evidence-based screening practices in low-resource or underserved areas with an emphasis on follow-up and treatment, and adapting, implementing, or sustaining evidence-based screening and follow-up practices in clinical settings. Also, NCI is interested in developing and or testing healthcare delivery intervention approaches, which includes modifying social determinants of health to improve delivery of evidence-based cancer screening, or testing implementation strategies that increase uptake of evidence-based cancer. So next, we have Dr. Marcel Salih from the National Institute on Aging.
Thank you. I'm from the National Institute on Aging and the Geriatrics branch, and we have a great interest in screening across the lifespan, and especially in older adults. And some specific topics are listed here on this slide, such as evaluating the impact of personalized preventive care program on screening, the impact of programs to encourage the use of the annual wellness visit overall and through mechanisms that would increase the use among underserved populations. Another specific interest is to evaluate low-cost interventions designed to improve physician adherence to recommended screening guidelines to increase the use of preventive services and improve health outcomes. Further, we're interested in approaches that would enable screening interventions to be focused at those at particular life stages or across the entire life course, and also to determine how linkages and more coordinated screening activities across various healthcare and community settings could result in more efficiencies and improved health outcomes. We're also open to investigator-initiated topics relevant to the NIA mission on screening. We encourage the use of existing data sets and have some resources listed here, specific data sets that are available through NIA or through our funding, such as Health and Retirement Study or the Midlife in the United States MIDA study, which have rich data. Other options are certainly open, such as use of Medicare claims data. I would highlight that we also participate in funding announcements that address overscreening, such as the one listed here. Thank you.
Thank you. So next we have Dr. Robert Freeman from the National Institute on Alcohol Abuse and Alcoholism.
Thanks. The NIAAA, I guess I would say that over the years, there's been so many investigations of screening and brief intervention and referral to treatment for problem drinking that we're probably talking, you're mostly looking now at systematic reviews just to summarize the great volume of data. But there are still, even with this plethora of research, there's some populations where we know less about, and that's illustrated in this first bullet point on establishing the feasibility and efficacy of providing screening opportunities among non-white populations, those with lower education levels, and pregnant women. Similarly, there's certain settings where screening for problem drinking is not been done in such numbers, and that includes, in our next bullet point, things like elderly care settings, primary care, emergency departments, and community settings. Our next bullet point calls for increasing the consistent use by primary and ED physicians and others of appropriate screening tools. It's one thing to ask people, are you drinking or have you been drinking? But I mean, that's just not exactly a screening tool. So it's getting to that phase is what we're using the tools that can detect the full spectrum of alcohol misuse is what we're encouraging. And then finally, looking at going beyond the screening to increasing the use of brief advice and referral to treatment. It's so the patient is not left wondering what he should do next after the screening. So those are the things we are emphasizing in this FOA.
Thank you. So next we have Dr. Jacqueline Lloyd from the National Institute on Drug Abuse.
Good afternoon. My name is Jacqueline Lloyd, and I'm in the Division of Epidemiology Services and Prevention Research in the Prevention Research Branch at NIDA. First, I'll start with our mission, which is to advance science on the causes and consequences of drug use and addiction, and to apply that knowledge to improve individual and public health. Some background with respect to screening for drug use. The United States Preventive Services Task Force has concluded that the current evidence for screening adults for illicit drug use is insufficient and does not recommend screening in primary care for adults, including pregnant women. There is a need for research to contribute to the evidence based on screening for illicit drug use and substance use disorder, prescription drug and opioid misuse, and opioid use disorder in adults, including pregnant women in primary care and other healthcare settings. In addition, there is a need for research on screening in adults in settings beyond primary care, in settings where young adults work, where they access community services, engage in social and recreational activities, and other settings that are opportune for accessing and engaging this population, particularly in settings that are underutilized by vulnerable and at-risk populations. In terms of areas of interest, our areas of interest are listed here, but are not limited to these areas. This includes development and testing of models for screening and brief prevention and treatment interventions for illicit drug use and substance use disorder, prescription drug, opioid misuse, and opioid use disorder, and particularly testing of strategies that facilitate linkage to prevention and treatment services. Second, development and testing of models and strategies for screening and linkage to prevention and treatment services for diverse and vulnerable populations in diverse healthcare and other settings and systems. Healthcare settings might include primary care, as well as urgent care, emergency departments, prenatal clinics, federally qualified health centers, college health centers, workplace health settings, college health settings, surgical, orthopedic, pain, and other specialty clinic settings and behavioral health systems. And other settings and systems beyond healthcare might include criminal justice, child welfare, social services, workplace, community, recreational, and other systems and settings. And strategies that facilitate completion of the screening and linkage to care services process, taking into account the complex and multi-level environment in which patients and individuals receive care and transitions in and out of care and from one system to another. Third, development and testing of models and strategies for integrating systematic screening, referral, and linkage to prevention and treatment services in healthcare systems and practices. So this might include algorithms, decision tools, reminders, and also testing of strategies for sustainability. And fourth, validating existing or new instruments for screening for substance use and misuse, particularly for prescription drug and opioid misuse and in healthcare and non-healthcare settings. And finally, testing use of innovative technologies to enhance and increase uptake of screening and linkage to prevention and treatment services in healthcare and other settings. Just a couple of mentions. One of particular interest is research that focuses on screening for opioid misuse and opioid use disorder and linkage to prevention and treatment services in settings where high-risk individuals can be accessed and engaged. Second, development of strategies for accessing, engaging, reaching high-risk populations in order to screen and provide linkages to services. And third, highlight moving beyond just screening to provide brief intervention and linkage to services as appropriate. Please feel free to reach out to me, the NIDA program contact, if you have any questions.
Thank you. So next we have Dr. Darian Weatherspoon from the National Institute of Dental and Craniofacial Research.
Thank you. Good afternoon. Just to provide a little bit of background, the dental office is a primary care setting that provides the opportunity for oral health practitioners to conduct preventive general health services, such as evidence-based screenings. Many adults in the U.S. may have a dental visit in a given year, but not a routine medical visit. Therefore, evidence-based health screenings in dental offices provide the opportunities to screen for chronic conditions beyond those conditions specific to the head and neck region. For this funding opportunity announcement, NIDCR encourages studies focused on implementing screening and referral for conditions that have received a grade by the U.S. Preventive Service Task Force, such as diabetes, hypertension, and/or HIV, conducted by oral health professionals in a dental setting. Specific areas of interest could include, but would not be limited to, improving the provision and uptake of screening in diverse dental settings, particularly those settings that target underserved populations, exploring the willingness or acceptability of screening for conditions by oral health professionals, improving rates of referral following screening, determining the degree to which patients follow up with and visit a physician or medical provider after being screened and referred, or enhancing screening and referral using technologies such as integrated electronic health records or clinical decision support systems.
Thank you. So now we will move on to the National Institute on Mental Health. Dr. Denise Giuliano-Bolt will present NIMH's priorities.
Okay. Hi, I'm Denise Giuliano-Bolt, and I'm a program officer in the Services Research and Clinical Epidemiology branch at NIMH. And I just want to start by going briefly over the mission of NIMH, which is to transform the understanding of mental illness through basic and clinical research, paving the way for prevention, recovery, and cure. So you can see on our slide what we've highlighted as areas of emphasis under this announcement, which is our interest is in developing new screeners only when there's really a justification for new screeners, and alternatively implementing the use of existing screeners when there are validated ones in their intended settings or in new settings. The approaches we expect would address symptom detection and must either include or design to be delivered in combination with referral and follow-up for engagement in treatment. So similar to what the other institutes have said, we expect screening to include setting someone on the pathway for getting diagnosed and treated if needed. Populations with inadequate symptom detection are what we focus on in this announcement. Limited access or poor treatment engagement. We list there the underserved populations that we have a special interest in, and also the second sub-bullet there is our special emphasis areas, which include detecting early psychosis or first episode psychosis, suicide or self-harm risk, previously undetected autism spectrum disorder in adults, or co-occurring medical conditions in people in psychiatric treatment, especially among young adults. Our settings of interest include mental health specialty and non-mental health specialty settings, community settings, novel settings, or providers. We encourage the use of technology, sustainable and designed for integration into existing organizational practices or systems. An application in the technology area should justify how the technology will substantially improve outcomes over the existing evidence-based approaches. Next slide.
Thank you.
Looks like one of our slides got missed. I just want to add that NIMH has a special emphasis on having our studies use a mechanistic approach so that the design of the study doesn't focus just on whether the intervention works or not, but helps us understand how it works, or potentially when it doesn't work, help us understand why it doesn't work. And so we have a lot of information on our website about our approach to clinical trials, and folks who are interested in submitting an application to NIMH under this announcement should contact me so we can go over that information and you can really tailor your application to meet our requirements. Thanks.
Thank you. So next we have the National Institute on Minority Health and Health Disparities, and Dr. Rena Das will present.
Hi, everybody. My name is Rena Das, and I'm a program officer in the Division of Scientific Program at NIMHD. For this particular presentation, I just wanted to briefly go over our mission. NIMHD's mission is to support research on minority health and health disparities. So what do we mean by minority health? These are basically health characteristics that are distinct for any one racial ethnic minority population. And these minority populations are defined according to the current OMB categories. These include Blacks or African Americans, Asians, American Indian, Native Hawaiian, Latinos, or Hispanic. So one could propose research just on one of these populations. Or you can propose a study on understanding the causes of health disparity, which is defined as a health difference that adversely affects socially disadvantaged populations. And for health disparity populations, we include the racial ethnic minorities. In addition to them, low SES, rural, and sexual gender minorities are also included who are socially disadvantaged. One thing to note that at NIMHD, we are not focused on any one particular disease or condition. We are interested in all conditions that has a proven health disparity. And we are interested in understanding the underlying causes of these disparities and interventions to reduce these disparities. For this particular funding announcement, the priorities for NIMHD include research on screening for conditions that are more prevalent in health disparity populations and for which health disparity populations have disproportionately low rates of screening and follow-up to treatment. So we are interested in both the etiology and intervention studies for this particular announcement. We would also like to understand the role of social determinants of health in different aspects of disease outcome. The projects may focus on multiple domains of influence, which may include biological, behavioral, social, environmental, or system level factors, and at multiple levels. Most of the research has focused on individual level, so we would like to encourage people to look at individual, interpersonal, community, and society level factors to understand screening behavior and effectiveness. Some of the potential areas include multi-level interventions to increase screening rates, clinical and pragmatic trials of efficacy and effectiveness of existing screening recommendations that have not been tested or implemented in health disparity population. We are also interested in understanding the mechanisms or use of novel technology to address screening gaps in these underserved population and improve follow-up. Also of interest is development and testing of new screening methods or guidelines that better capture disease risk for health disparity population, comparative effectiveness of different interventions to increase screening rates among health disparity population. I've included a link at the end, which is our research framework. So take a look at that. That will give you an idea of different domains and levels of influences that you may consider when you are defining your applications. Thank you.
Thank you. So you may notice that the Office of Disease Prevention has not presented a priority per se. The Office of Disease Prevention does not, we participate in the funding opportunities, but we do not manage grants. So we can only co-fund successful applications. Therefore, the grants or the applications that will be assigned to one of the institutes that participated in this webinar. Applicants are highly encouraged to discuss your potential research aims and ideas with program officials from the participating ICs. So if you have ideas that may span across more than one institute, I encourage you that before you apply to talk to the program contacts at those institutes. So again, here on the webinar slides, we have links to the program announcement and also to the frequently asked questions document. We recommend that you access that document for additional detail. And now the floor is open for questions. We have received a few questions from our potential applicants, our participants. So I guess the first question would be directed to aging. You referenced secondary data sets. Do you have interest in original data collection, qualitative research, or focus on caregivers?
Yes, definitely. NIAAA is interested in new data collection and as well those other topics mentioned, certainly. And the role of caregivers is prominent among our interests.
Okay, thank you. So the next question is to NIDCR. This question, does the mission of Mercy Emergency Dental Clinics work? These are not in offices, but in public places like the Xfinity Center or high school gyms.
I mean, yes, that would be considered kind of a diverse setting, non-traditional setting, so that would absolutely be applicable for this FOA.
Okay. So the next question, I think probably NIMHD may want to take a stab at. Are persons experiencing homelessness considered an underserved group by the various institutes?
I guess they would fall under the low SES population. So if you have a way of engaging them in a study, that would be applicable.
Okay. And
for NIDA, that will be considered at-risk group, vulnerable population that we would be interested in as well for this FOA.
okay. So that actually kind of addresses the next question, which institutes might be interested in homeless populations. So you heard at least two.
Yeah, aging is interested in the homeless aging people.
Okay.
So.
This is Denise Giuliano-Bolt from NIMH. We also have an interest in homeless people who have mental illness.
Great.
And I think we would too.
Okay. And
All in NIDCR as well.
so everybody. All right. So this question is probably to CSR. Which study section would be appropriate for an HIV screening proposal?
The dissemination and implementation research does accept AIDS applications. So that's also appropriate if your research aligns, if your proposed study aligns with implementation science. But I do encourage you to look at our website, and we do have an AIDS group, integrated review group, and you can also look at their study descriptions to see what specific science they review in terms of HIV/AIDS.
Okay, thank you. So this next question, I'm not quite sure what is being asked here, is how much time is needed to do the research on a particular subject? So, yeah.
R01, right? 5-year study.
So you can have up to 5 years. If you're asking how much time you can have up to 5 years. I would say this is an R01 mechanism. So I would say that these studies would at least take 2 to 3 at minimum. So it really depends on what you're doing. And if you have a specific idea or specific topic, I recommend that you speak to the program officer at the institute that you believe would be of interest in your work. So the next question, is there any interest from NIDA on smoking or tobacco use among underserved populations in primary care?
Yes. Sure, yes. There is interest in that.
Okay. Are there other questions? Okay, so the next question is, are there multi-site projects that may require coordinated grants, potentially with different lead institutes or conditions allowed? Or is that for discussion with POs?
So for aging, we're open to multiple topics and not disease-related topics. So the screening, if you look at the age-based screening recommendations, there's many that are recommended for people in their late 50s, 60s, 70s years of age. And so we are open to that multiple types of screening, as I indicated in my remarks earlier. I think if you're asking about co-funding, could the institutes co-fund? I mean, I think we're open to that also.
Could you repeat the question, please?
So, yeah, I'll repeat it. Thank you. So, wait a minute, we lost it. Multi-site. Okay. Are multi-site projects that may require coordinated grants allowed? Or
multi-site.
Yeah. Or is that for discussion with POs?
Is that like a link to R01?
Yeah. Yeah.
So I think NIA would accept multi-site trials, if that's what it's being asked about, multi-site, and we would review those probably in-house rather than having them CSR reviewed for a multi-center trial. That's because that's our practice at the Aging Institute. But you definitely should talk to the program officer if you're contemplating a multi-center trial, because that's a big undertaking to gauge the level of interest and other factors you might have.
Okay. Thank you. So the next question, is there a minimum number of screenings we should complete in 5 years? So the short answer is no.
This is research to enhance.
Yeah, this is research to enhance evidence-based screening. So there's no number of screenings that you need to do research on, if that's your question. And generally, if you have an idea, I would, in a specific area, I would encourage you to speak with the program official at one of the institutes that are participating.
I think each, whatever screening topic that you choose has to be well justified, and there has to be a strong scientific premise for it. So you may choose one condition or multiple condition as long as they are justified and feasible within the time limit.
Yeah, it's a scientific,
Depends on the question.
it's a scientific question. I mean,
Right.
it's not, there's no, receipt referral isn't going to reject your proposal because there's not enough.
Yeah. Well, a study should be adequately powered to
Yes.
answer
Right.
questions.
Right.
So I think, that's the key issue on numbers of screenings, probably from an analytic point of view.
Okay. So I'm going to skip to another question to aging. Would you be open to using data from NIA intramural projects like the BLSA or the Handles project?
Yeah, we can give grants for analyzing our intramural data to collaborative groups that include both intramural and extramural scientists. So yes, that's a possibility.
Okay. So are there other institutes that are interested in secondary data? You may want to...
Yeah, I think for NIMHD, we are interested in both secondary and primary data. So it depends on what the study design is.
That's true for NIMH also.
That's true for NIDCR also. There's some electronic health records that could be used, so there might be secondary data.
Also for NIDA, depending on your research questions.
Okay. So there are a group of questions that are more about the application process. I will announce those questions, but I'm going to hold off for a moment and get the topic-specific questions. So the next one is, would you be interested in validation of ambulatory tools to assess and ameliorate deficits in cognitively impaired individuals at risk for dementia? So NIMH.
Okay, I'm sorry. Repeat the question.
Okay, would you be interested in validation of ambulatory tools to assess and ameliorate deficits in cognitively impaired individuals at risk for dementia? So NIMH and maybe NIA?
Well, so from NIA's point of view, the dementia screening is not considered a recommended test at this time by the U.S. Preventive Services Task Force. So I think this FOA is not a good fit for such a question, but we are interested in that topic at NIA, and so there are other avenues to pursue funding for such a study with NIA, and if the person wants to contact me, I can refer them.
Right, and this is Denise from NIMH, and there is a boundary line between our interest and NIA's interest in this area, but I'm not well versed on what that is. But if, as this question is being explored, if it looks like the project is a fit here, you can contact me and I can refer you to the appropriate contact here.
Okay. Thank you. So let me get to the, I think, general question. So for those who are newer to applying to NIH, can we provide a high-level overview of the application process? So in short, I would say the first and most important thing, please talk to one of the program officials. So as soon as you have a kernel of an idea, that's the appropriate time to send an email or pick up the phone and call and discuss that with the program officials. Anyone else want to add?
And for NIDA, it's helpful if you can send a concept paper that includes your study aims, the research that you have in mind, your approach, maybe a little bit of background.
Okay. Now keep in mind, that's not a part of the review process. That's just having discussion prior to application. Anyone else?
And for CSR, we receive study aims and to see if it fits within certain study sections, and that is fine, but again, that's for review, and we always refer direct applicants that they should talk to their program officials specifically about their aims.
And if I can just follow up for the concept paper, brief, 1 page is fine.
Okay. So
usually what happens is that somebody of interest in this FOA will contact the program official with 1-pager outline, and then they'll have a discussion. If there is a fit, then you will move forward and prepare a full application and submit to CSR. The referral office would then assign it to a particular agency. If you are interested, your application to go to a particular agency, you should indicate that in your application, like was mentioned from the CSR presentation. And then it goes to the review, and then the usual process starts.
And program staff can also assist with thinking about what might be the appropriate review group as well. And then I think it was already mentioned, if you're trying to decide between 2 institutes, it's a good idea to talk to contacts at both institutes.
It almost sounds like this is really a general question about the whole process, which I don't have the link in front. There's videos, aren't there, online that you can watch? And
there are videos online, and at least in relation to the review part of the process, this PowerPoint and the entire webinar will be up on the Office of Disease Prevention website within a week. So you can go back and have access to all of this, all of the links, and we can even add the link to that entire process. Okay, so the next question is, are interventions necessary in this funding opportunity announcement?
No, we, at least for NIMHD, we are also interested in understanding the underlying causes for a disparity. If there is a disparity in particular screening behavior, what are some of the causes, whether they are at an individual level or a system level. We are interested in understanding that as well.
Well, screening is kind of an intervention,
Yeah.
so.
Yeah.
But
I mean, you know.
not all has to be interventions.
So again, the importance of talking to the program officer at the specific institute, because there are, you know, emphasis in different places. So the next question, is it okay to conduct screening research in non-traditional settings? Yes, that is one of our major foci for this this program announcement. So what is the interest in project screening for sleep disturbances and disorders, particularly in underserved populations? Well, I will take a stab at this. So if you're interested in this, this is Dion Gaudet with ODP. Please contact me. I can put you in contact with an IC program official who may have interest in that topic. They're not in the room. So that's the short answer to that question. Any other institutes interested in that area?
Whatever the guidelines are for those screening, if they are not being followed, then one can look at it.
Actually,
At this point in time, there are not discrete evidence-based guidelines related to sleep disorders. This is Rachel Ballard from the Office of Disease Prevention. So most studies that would examine questions related to that type of screening might not fit well under this funding announcement. But as Dr. Gaudet said, there are other there is interest in that question just at NIH, and if you have more questions about that, you should contact her.
and in relation to that last question, there are ICs, as I said, that are interested in such topics like the National Heart, Lung, and Blood Institute and NIDDK. And if you contact me, I can put you in contact with program officials who can speak to you more specifically about that. And so this question is whether trials to improve screening processes are necessary in the application. So this is a clarification of the first question on interventions. So whether trials to improve the screening process are necessary in the application. So this is a clinical trials optional program announcement. So clinical trials are not required, but they're allowable. Okay. Is there interest in depression screening among diverse underserved populations? Denise, are you still there? Okay, but I would say yes.
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 Okay. And is preliminary data required? No, it's not required, but I would suggest again that you speak to the program official as institutes vary in their interest.
Hey, this is Denise. I'm sorry I was on mute.
Oh, okay.
Yeah.
And RCTs are not required. They are allowable. So we have about, go ahead. We have about 5 more minutes. Are there any other burning questions? Okay. How many awards? There are no set number of awards. Because this is a PA, I recommend you just try to score as well as you can. Okay. Total direct costs. 500K. So I'm going to let the ICs respond to this.
So for NIMHD, it has to be 49999
Per year.
per year for 5 years.
They should talk to the PO.
Yeah, you really should talk to your proposed program official.
Right.
On direct costs.
More than that, they must.
Yeah, so
Yeah.
for NIDA, which might apply to other
Yeah, that's-
places as well, if you're coming in over 500K, you need prior approval for that.
Yeah,
And
that's a
that
whole-
needs to be submitted 6 weeks in advance of the application submission, so I suggest that you get in contact with your program contact well in advance.
Mm-hmm. All right. Is there a minimum number of screenings we should complete? Well, I think we answered that question. Is there a total? No, there's no set aside. This is a PA, a program announcement. It is not, there are no set asides.
So it's good to recognize that the fact that this is a program announcement means that there are multiple receipt dates. So you have time to develop your ideas and submit, and you can submit multiple ideas depending on your energy, time, and resources to do that. It's also important to recognize that while there is no set aside, there also is no limit in terms of the overall amount NIH might spend on the whole sum of grants that are submitted to this area. We think this is an area that needs focus and attention, and the number of ICs that are involved and are interested in receiving applications is a strong statement of NIH interest in this understudied area. So we encourage investigators to submit, and it is a general experience. If there are a generous amount of applications, we are able to get reviewers who know the area well and can do better jobs in review. So we hope that people will think carefully about your ideas and submit proposals to this.
Okay. And I think that answered the next question we got. There's one more question about access to slides. Yes, you will have access to slides and the recording. So within a week, these slides, currently the frequently asked questions are up on the Office of Disease Prevention website, and the recording will be up on the website. Okay. Well, thank you very much for your participating participation in this webinar, and good luck to all of you, and we look forward to your applications.